saying I'm always excited when other people want to join the field, because Lord knows we need you. We all need therapy, child. So yes, I'm so glad that you want to pursue your PsyD. So yeah, I'll do a quick rundown of what I did. So obviously graduated high school. And then after high school, I went away to college out of state, got my bachelor's in psychology. Now you don't have to get a bachelor's in psychology, but it definitely helps set you up more easily to get into a doctorate program if you do get your bachelor's in psych, because then you've already taken a lot of the prerequisites and stuff for those doctorate programs, right? So that's what I did. I got my bachelor's in psychology because I love psychology. I've been actually studying psychology since I was 8 years old as a response to my own trauma. So see, trauma responses are not always bad. It caused me to want to be curious about why people were the way that they are. And it really saved my life going to therapy and learning psychology. But anyway. So yes, get your bachelor's in something, but ideally psychology to make your life easier. And then after that, you are going to, it depends. If you're doing a PsyD, you said you want a PsyD like me. So if you do a PsyD program, most PsyD programs have what's known as a master's degree along the way. So that means that you can just apply to the doctorate program straight after your bachelor's, which is awesome. You do not have to apply for a separate master's program and then the doctorate program for most PsyD programs because the master's included. So PsyD programs are 5 years. The first year you're going to take classes, and then the next 3 years you're going to take classes and have residencies at the same time. You're going to do part-time residency and then also be taking classes. And then the last year, the 5th year, you're going to just work full time at a residency, and that's the residency that you get paid. You don't have any classes that 5th year. And then you graduate with your doctorate, and you are technically an unlicensed psychologist at that point. Then after that, you have to take the EPPP, which is the licensing exam that we have to take. For most people, they study for about 3-4 months. And then you take the exam. I passed the exam on the first try. It's definitely a lot of studying, but if you study, you tend to do well. I think people most times pass on the first or second try on average, I would guess. And then once you pass the licensing exam, that's it. Now you're a licensed clinical psychologist. Of course, you can decide during your schooling if you want to specialize in anything. I personally kind of recommend just getting a generalized degree, because then that allows for you to have a depth and breadth of knowledge so that you can help a large spectrum of people with different presenting problems. But you can also specialize, like if you really love doing couples therapy or things like that, then there are some PsyD programs that have those specializations if that's something you know that you want to specialize in. But yeah, that's pretty much the process for the PsyD. Most of them, like I said, have a master's degree along